Today, we're joined by Dr. Karthik Ghosh, Chair, Division of General Internal Medicine at Mayo Clinic. Welcome, Dr. Ghosh.
Thank you, Dr. Barker.
It was so awesome to hear you and Dr. Gill talk about emotional intelligence earlier at GRIT today, and having witnessed you as a leader within the Division of Internal Medicine at Mayo has been just absolutely inspirational. So thank you for taking out the time to making it to GRIT and the time to share your wisdom and insights with our audience.
Thank you. Thanks again for inviting us here. And it was such a fun experience actually working with Dr. Priscilla Gill on this. It was a lot of fun. When you do a talk, it's a little different, right? You have to kind of come with a background of information and what emotional intelligence means, and also some take-home points for the audience as to, all of us, we're all still learning this process and trying to get better at it.
Yes. And before we dig into emotional intelligence, Dr. Ghosh, we would like to know some interesting facts about you.
All right. Well, I'm originally from India. Grew up in a group of islands called the Andaman and Nicobar Islands off the east coast of India, and did my medical school training in the same place as you did, Lady Hardinge Medical College in New Delhi, and then did a post-graduation at PGI in Chandigarh, the Postgraduate Institute of Medical Education Research. And then we took the big step of coming to America. My husband, Dr. Karthik Ghosh, who had the opportunity to come do a fellowship. So it was, I just had my baby. We were coming here to new area for a year, and the rest is history. Here we are 26 years later in this beautiful country. So we're grateful.
Wow. That's great. I would imagine there was a lot of grit that went into your move.
You bet.
With a little baby and a new place to adjust to. So on that note, what does grit mean to you?
Grit is about persevering, about having the ability to be, you're passionate about what your goals are. But when you are younger, many a time you don't really know where you're heading to. There are certain things that you believe in and you follow that. But the other part to it is, kind of having a commitment, and you evolve over time, I think. Of course, when I was younger, if somebody had said, what does grit mean to you? Perhaps it was about, working hard and accomplishing certain things. Now grit is about a bigger picture. I think it is about service and making sure that the care of the patient, the care of the people that take care of the patients, everything is aligned in the same direction, and thinking about the future and staying true to those goals.
Yeah. Well, that's very interesting that grit is not a definite construct, and what it means to you changes as you evolve, as you go through your life journey and you form your worldview. Your grit view also evolves through that, and it sounds like that's been your personal experience.
That's right.
You shared some amazing pearls with the audience, over 400 women in the audience today, about understanding emotional intelligence. So how would you define emotional intelligence?
Well, emotional intelligence, and again, there's definitions, So I had talked about in 1997, a real definition for what emotional intelligence is was done by Meyer and Salovey. But then Daniel Goleman described certain skill sets. So there are 5 sets of skills that define emotional intelligence, one of them being self-awareness. And I think that is crucial. Self-awareness is us being aware of the ability to be aware of our own emotions. It gives us that moment to understand, why am I feeling the way I'm feeling? Then there is self-regulation, which is actually being able to control one's emotion. So it's when you know this is coming, you take a moment, breathe, think about it before you react. Then there's social awareness, and that is empathy. This is about trying to understand other people's emotions. And social skills is that ability to influence people, manage relationships, and then the internal motivation. So those are, Daniel Goleman has written some books, and he's done a lot of work in this area, so that's where I'm quoting this from. So that's what I would say are skill sets. And then some of the things that we described there were behaviors that emotionally intelligent leaders kind of demonstrate. Those are things like being respectful. Even when you're doing crucial conversations, you can do it with respect and dignity. I think that's very important. being able to develop others, communicating effectively. You know of all those people who come and talk, and you're like, they're great communicators. So those are emotionally intelligent leaders are great communicators. And then they're great coaches. And emotionally intelligent leaders are also great at recognizing others. So some of those behaviors that, even if you get these little tips, you can say, maybe I can do better on this, and how can I emulate? And you'll see in our day-to-day life, we see these amazing emotionally intelligent people, and you say, that's what I want to be, and try to pick up those skill sets. And it's a constant work in progress.
Yes. Well, having personally witnessed your leadership and being fortunate enough to have you in our division as such a strong and emotionally intelligent leader, how much do you pivot your leadership style on emotional intelligence? That's the first part of my question. And the other part is, you talked about a lot of constituents of emotional intelligence. Would you say that one is more difficult than the other to cultivate?
That's a good question. I don't think of myself as emotionally intelligent. I think some of it is being respectful, for example. So I think those are some values that you just kind of inculcate. It's the same things that we're taught in childhood, please and thank yous. Things like that are just basic concepts, really. One of the things I have to say, when I had to interview for this role, I was asked, one of the comments about me was, you're seen as too nice. And I was asked that at the interview by the entire panel. Well, you're seen as too nice. Yeah. And I thought, well, I don't know that I'm too nice. I have had some crucial conversations with people that I work with when I've had to have that. And I can be pretty firm and clear about what needs to be done. But you don't have to be disrespectful to have crucial conversations. And so if too nice is what being respectful means, so be it. I own that, because that's just who I am.
And in your experience, do you think women get that feedback more?
Good question.
Often, like when they talk about strong leadership, emotionally intelligent leadership, how does that fit into, what's your perception in your role and how you move amongst the other leaders?
Perhaps that's a possibility, although I'm not sure. I think we'll just have to see how, as we evolve. You're right. We had a lot of the conversations this morning where, the stereotyping, the behaviors can get stereotyped. And I think we have to be conscious of that and not rush to judgment. When we see somebody stepping up or making a comment, rather than saying, oh, that person is just, brash, or just try to say, what are they trying to get at, and we're human beings. I think we need to give each other a little space to kind of be able to express where they're coming from and give people the opportunity to explain. The part about social awareness, which I really value in EI, in the EI emotional intelligence skill sets, is that give others a little leeway to explain where they're coming from. I think when that happens, it's the same thing we talked about. When you're in a meeting and somebody is just upset, don't take that as a negative. Try to find out what is it that irks them. And maybe we can all get to the answer if we understand what's going on there. Because one person speaking, there may be 10 others feeling the same. So similarly, it's like when somebody says something, rather than just kind of labeling, it's better to take a moment and say, let's find out and get to the bottom of it.
Personally, as I reflect, to me, for example, awareness comes easier than regulation. I feel like I have to go that extra mile. Like self-awareness, I feel like I tend to be very conscientious and self-aware, but self-regulation is where I personally feel a lot of like extra work that I need to put in. That's why I asked you the question.
Completely agree.
Is it just a unique thing that I'm experiencing, or do you feel like...
Oh, no, completely. I consider myself completely a work in progress. I mean, like you said, The other thing, self-regulation, for example, it differs, right? Within minutes, you've said it and it's out of your mouth.
Exactly.
And sometimes I think in venues, for example, at home, I think Perhaps I'm not as self-regulated as I should
would say
be,
that's
you know.
the area I have to work harder on my self-regulation too.
But one thing I do say, and I expect that of the children, I have amazing 2 kids.
Yes.
I always say, when you act up at home, for example, and I will say my mom always let us do that, is it's okay to act up at home.
Yeah.
Just when you go out, don't do those
Right.
things. Somewhere we have to have the comfort, as long as it's still respectful. It's not that
Yeah.
you go crazy, but with being respectful, if you can kind of just be for a bit,
Yeah.
it allows you to kind of recalibrate.
And just to reframe what you just said, like we could have a safe space to evolve,
Yes.
where we can work on our self-regulation. Because I feel like at work, for example, it's such an active place of so many different players.
Yes.
Everything needs to come, and I'm talking specific to healthcare
Yeah.
in our profession. So we need to come prepared.
Yes.
We need to come with a level field where we are working actively.
Yes.
Yet sometimes that space is not wide enough.
Yeah.
So we have to constantly work on evolving outside of that space.
That is so true.
Sometimes. You had great activities today in your talk where you forced all of us to reflect deep and see where our gaps were, or what, how we were so diverse.
Yes.
And how we thought about these topics. And one thing that I have read about, and I think it's known fact, that emotional intelligence tends to be inversely proportional in some way to the level of leadership. And it's fascinating. It's hard because higher leadership is about driving results.
Right.
So is leadership at all levels, but I think the stakes are so higher up. What are your comments about that?
Great question. One quick thing I want to mention before we go into that was, those talks that we had where you exchanged information.
Yes.
Dr. Gill, she is the one to be credited for that,
Yes.
because it was her idea. We should have breakouts. Let's make it interactive. So I
Yes.
have to give kudos to the person that came up with the
of course.
idea. We loved it. So coming to seniority, as you get senior, does emotional intelligence decrease? I mean, I know that there's some literature on that. It's just that I've seen some amazing leaders. I mean, I think we at Mayo Clinic have been blessed with some incredible
Yes.
leaders.
Yes.
I found them to be quite emotionally intelligent, at least able to be able to communicate well. I think sometimes it is our perception too, right? They have to communicate. Again, I don't know enough about all the details of that. I wouldn't consider myself the expert to speak to that. But I wonder if, when you're at very high levels, when you're driving performance and you are held accountable to that, the rest of the team doesn't see that emotional intelligence part of you.
That is interesting,
That
yes.
perhaps it is the people that work closely with you or are part of the executive team who may be able to see that. But perhaps they don't have the ability or the opportunity to connect with the rest of the crowd to show
bandwidth
to
right.
show where their emotional intelligence lies. Again, I'm not sure,
Yeah.
but you wonder, because the other thing is, have we evolved over time? Perhaps many years ago when it was, male dominated, where it was seen that you need to be, strong leaders meant you just tell it the way it is. And that's just how it's going to be.
It's my way
Maybe
or highway?
there you go. Perhaps that's what the studies are reflecting.
Probably.
So
Yes.
hopefully we evolve
Yes.
to a new standard where we expect our leaders to have that level of emotional intelligence. And like I said, Daniel Goleman's piece about what makes an exceptional leader, those capabilities, he said, were technical skills, which is, again, driving performance. That's the intellectual capacity, the cognitive bandwidth, so the ability to do the visionary stuff. But he describes emotional intelligence as probably being the most significant skill set that actually drives the team to be engaged and ensures future success. So along those lines, I would think that leadership has to be emotionally intelligent.
Right. And I have to admit, I've had the distinct opportunity to have met with Daniel Goleman when he was
amazing.
visiting at
Okay.
Mayo Clinic at one point, and he truly lives his model of EI, and it was beyond inspiring. And I got really interested in his work, actually, after meeting with him.
That's incredible.
Yes. What are your top 3 takeaways you'd like to leave our listeners with when it comes to EI and leadership?
I think the first thing is self-awareness, Be good to one another. So that's social awareness. Try to understand one another. And if somebody's having a bad day, kind of help out. I mean, don't be rushing to judgment. And building on skills, that these are skills that no matter where we are in the spectrum, we can always develop. So the more we are aware of it, that these are skill sets we can develop, keep working on it, practice, be open to coaching and feedback. That will definitely help you no matter where you are, whether you're aspiring to be a leader, whether you're aspiring to the next position you want to do, but just to be a good person. I think the future is here. So
yes. Before we leave, you've been on this new journey in this new leadership role. What is one of your top go-to human sort of qualities that you bank on to be effective in your leadership role?
I think being a good listener.
I would so agree with that.
Yeah.
Yes.
Because, I think if you listen, you will understand where everyone's going. And I think you can make a thoughtful decision about, I think if that's the single most important quality, that you have to be paying attention to people.
And that's a learned skill too, active listening.
Yes.
And that's an important component of EI.
That's exactly right. Amit always tells me, listen not with just listening, but with your heart. You have to pay attention to what are they really saying, So.
Yes. Well, it's been great talking with you today, Dr. Ghosh. Thank you for joining us on the podcast and sharing your expertise and your wisdom with us today.
Thank you, and congratulations to you on GRIT. It is an incredible experience.
Thank you so very much.
Thank you.